That was Professor Uchenna Uzo earlier on Business Morning today. But still looking at prices at this point. In Nigeria, we see the price of life-saving pharmaceuticals have risen over 100 to 200% in recent times, making it difficult for Nigerians to afford basic medicines. Meanwhile, vaccine affordability is another big issue with the likes of GAVI and its partners trying to make vaccines affordable. Let's talk to Emily Kobayashi, now head HPV program at GAVI. Great to have you on the show.
To be here, thank you. Good afternoon.
So I heard about the $5 million commitment from the Girl Effect. Talk to me about this fund and how GAVI is matching this to amplify its impact.
Yes, happy to. Girl Effect is an organization that brings an incredible specialization in engaging with girls themselves. And with the HPV vaccine, that's extremely important because we're targeting girls aged 9 to 14 to receive the vaccines in Nigeria. So Girl Effect does in-depth research with the girls themselves. They learn what motivates them, who influences their decisions, where they get the information, and then they develop a multimedia response that reaches those girls where they are and supports them in accessing vaccines.
All right, so how does this, the partnership with Girls Effect, how does it enhance GAVI's mission to increase HPV vaccine uptake?
Well, we are very glad to be partnered with the National Primary Healthcare Development Agency in the rollout of HPV vaccine in Nigeria. We know that for a rollout to be successful, we need to have effective approaches to communicating with communities about the importance of the vaccine, its safety, and its benefits in preventing cervical cancer. So the Girl Effect investment adds power to that introduction of the vaccine by creating more channels for communication to those girls using social media, WhatsApp, communicating with parents, communicating with teachers and other educators to reach those girls and encourage them to take the vaccine.
Well, I guess getting access to the vaccines, that's another issue on its own. What strategies will be employed to ensure equitable access to the HPV vaccine?
The important thing about HPV is to think about where do we find 9 to 14-year-old girls in Nigeria? And we hope that most of them will be finding in schools, but it varies a lot by state. So what we've seen is really powerful is the investment in individual states who have made their own plans, their own assessment of where they would find those girls, down to the last school, religious institution, settlement, and they're now implementing those plans in 21 states across Nigeria.
All right, so what's your outlook for vaccine affordability in Africa?
So GAVI is very proud to support the provision of free vaccines through the public health sector. We do this in partnership with governments who do pay a co-financing amount, as well as with manufacturers who we are constantly working with to bring down the price of vaccines over time. So by having strong markets with healthy demand, we're working with manufacturers to bring down their prices and create a more sustainable, affordable market for those governments that are the major purchasers of vaccines in Africa.
All right, thank you so much. We'll definitely be tracking progress right here. Emily Kobayashi, head HPV program at GAVI. Thank you so much.
Thank you.
All right.